Hello, welcome to Leadership and Management. My name is Kim McAllister and I will be providing the lecture on this topic. Today we'll discuss quality and risk management. As we discussed in the CMS lecture, quality indicators are used by patient care agencies and impact reimbursement as well as accreditation. So these are our objectives of what we will be discussing. Learning how to use quality management and we'll be in risk management and we'll be applying it to a real situation. So besides the fact that we're required to do it, why is it that we look at managing quality and risk in the healthcare setting? Well, we can prevent errors before they occur, identify and correct errors after they occur, adverse events are decreased, safety and quality outcomes are maximized. We optimize patient outcomes, prevent patient care problems, and mitigate adverse events. So how do we do this? We use a comprehensive systemic approach, which we will discuss, and we also utilize standards of patient care and of quality care. We put all of this together to build our quality and risk management program. So there are many agencies for quality and quality measures in the U.S. and also many guidelines. The Nurse Practice Act for your state determines the standard of practice for licensed nurses. So be sure that you review your Practice Act in the state that you practice and also the states where you are licensed as well. Agencies have accreditation standards that set quality measures. For example, the Joint Commission sets national goals for patient safety. The U.S. government created the Agency for Healthcare Research and Quality. We call it ARC, and you can go to their website and look at their programs. They have different topics that they cover. You'll see their priority populations. There are a wealth of programs. We'll look at the quality and safety program in just a moment. They have a wealth of research, fact sheets, all kinds of things that you can find to use. They have data. There are different tools, and so you can see that there are specific tools for quality and patient safety. Funding and grants. If you have some new process you want to fund, you may be able to find funding there. They'll have the latest updates and then explanations of what and who they are. So let's look at the quality and safety program. And you'll see there's a lot of information here that you can look at. But let's look at the Patient Safety Organization Program. This will talk about how to specifically create a safe environment for patients. Tells you who all is involved in the setting. There are videos that you can look at on leadership, and they have just a specific website for the patient safety. And you can become an organization. There are all sorts of resources you can look at. So there's a wealth of information here that will help you. There are videos that will help instruct your people and you. There are webinars, so on and so forth. So there's a lot of information here. Next, we'll look at the National Quality Forum. The National Quality Forum is a group that will help to improve healthcare. And what they do is they endorse measures to support the national quality strategy. And you can see different information and benefits if you want to join that organization. We also have the National Institute for Occupational Safety and Health, called NIOSH. This is part of the CDC, and they provide research and recommendations for workplace safety. If occupational health is an area you're interested in pursuing as a nursing specialty, they do offer scholarships because there is a big shortage of occupational nurses. And I have some friends who got their nurse practitioner in occupational health, and it was all paid for by the scholarships. So something worth checking out. And then we'll look at the Institute of Medicine, and they provide resources for leaders and managers. They also release certain important reports, such as Crossing the Quality Chasm, looking at what's wrong with the quality and what we need to do for our healthcare system. And To Err is Human is the big landmark report on medication and medical errors. So let's go back to our presentation and also look at some of the other quality standards. And that can be your internal or external performance measures, your patient satisfaction surveys, opinion polls from your employees, patient rounds. Patient says this happens or something broke, whatever. Those are all other indicators that you will use to determine what needs to be done. You have policies and procedures. Those need to be reviewed to make sure that they are in line with the current quality standards. So that's very important, because sometimes when you review those, you'll see things have older standards. That's one of the first things that Joint Commission and other regulating agencies will look at when they come to do a review. So you need to make sure all of those are up to date with current standards. You can also research for yourself the current evidence for why you're doing what you're doing. Let's take a look at some terminology that we need to understand. Quality improvement is the ongoing process of using innovative ideas, prevention methods, and staff education and development to improve quality. Continuous quality improvement is the state of an organization pursuing quality improvement measures on an ongoing basis in order to reach quality outcomes. Total quality management is a healthcare culture that emphasizes customer satisfaction, innovations, and employee involvement. Quality assurance is the process of monitoring how quality standards are met or not met, usually in the form of audits. Risk management analyzes a problem after it's occurred to prevent additional problems or to minimize harm and prevent loss. So let's look at an example of how this works in practice. Rising numbers of medication errors have impacted the quality of life and even resulted in death. TQM processes was used at one hospital to determine cause and provide solutions to medication errors. First, they defined the problem and created objectives. Next, they examined the medication process. After examining records, interviewing patients and staff, researchers found 4 main causes. The prescribing errors were 42.8%. Administration errors were 24.8%. Monitoring errors were 18.2%, and dispensing errors were 14.2%. So under prescribing errors, which was the biggest level of error, they found that that was due to poor handwriting. So they implemented automation in their prescribing process. After analyzing nursing service, researchers found that proper administration policies and requirements place an increased demand on nursing staff. In addition, although the hospital administration was willing to fund new technology, they were unwilling to fund continuing education for the nursing staff. In order to empower nursing, participation of the nursing staff was recommended in development of nursing strategies to improve medication administration and nursing care. So then, to complete the process, the agency would evaluate the results of these particular policies and see if they resulted in improving of the same quality measures. So total quality management involves assessment of the agency's structure, processes, and outcomes. Structures include the facilities of the building, equipment that's used, the staff who's involved in care, and finances. Where does the money go? The process includes the nurse's role and evidence-based practice. Outcomes include quality measures desired by the hospital, state, and local regulating bodies and federal requirements. Let's compare the difference between quality assurance and quality improvement. Quality assurance, while viewed negatively by some employees due to continual examination and auditing to find errors, is the process of reviewing indicators for compliance. Quality improvement or total quality improvement is the ongoing process of preventing errors that affect quality. You can see here that they both have the same goal. The focus with quality assurance is to discover and correct, while quality improvement is to prevent. Those are the major differences. Quality assurance is carried out by the quality assurance team, and the quality improvement is carried out by an interprofessional team. Let's review the steps of the quality improvement process. Identify needs. Assemble a team of members who impact the issue directly and indirectly. Collect data. Establish outcomes and determine quality indicators and measures that will be used. Put a process into place. Evaluate based on objectives, outcomes, and indicators selected. Make adjustments as needed. Let's take a moment to consider the national patient safety goals that we've mentioned. Remember, these are developed by the Joint Commission. Those goals are accuracy of patient identification, effectiveness of interdisciplinary communication, safety of medication, reduce hospital-acquired infections, identification of specific safety risks, such as suicide and falls. Now that you've reviewed this presentation, ask yourself the following. How can a staff nurse make effective suggestions to improve nursing practice? How can a culture of assigning blame for errors be transferred into an environment invested in improving care? How can patients' expectations be used to improve nursing care and promote optimal outcomes? Quality improvement and risk management work together to prevent or to reduce harm to patients and improve outcomes in healthcare. Understanding these concepts will benefit you regardless of your role in nursing care.